There have been some extraordinary quotes this week from your colleagues. One is from Senator Chuck Grassley, talking really about the blunt political calculus here. Senator Grassley said, "I could maybe give you 10 reasons why this bill shouldn't be considered, but Republicans campaigned on this so often that you have a responsibility to carry out what you said in the campaign. That's pretty much as much of a reason as the substance of the bill." Senator Pat Roberts and other of your Republican colleagues essentially said that if this bill isn't passed, that Republicans would lose control of the Senate. And there's a New York Times piece in which you're quoted as saying, "Donors are furious. We haven't kept our promise." The picture that emerges from all of this is a rush for political reasons to support this and not substantive reasons. What are your thoughts about that?
Well, this has nothing to do with politics. It has nothing to do with donors. It has everything to do with the people of this country who are suffering each and every day under a health care bill that is failing to meet their needs, that's bankrupting them. 500,000 people in Colorado lost their health insurance, had their health insurance canceled, because they were told it wasn't good enough. It didn't meet the specifications, even though they wanted to keep that health insurance. And so,
Senator, there's been a great deal of opposition from the American Medical Association, from the directors of Medicaid in the states, to the substance of the bill. So all the problems you named can exist, but for this particular remedy, the criticism is that it's being forced through for political reasons. We all know from our reporting that there is great anger at the grassroots and at the donor level. And then you have senators basically affirming that. It seems hard to argue that there is not tremendous political pressure and that that's overweighing the substantive critiques to this bill.
Well, I think that the people who are opponents of the bill certainly want this to be about politics and not policy. But the bottom line is, for the past 7 years, we've made it a very high priority to put something in place for the American people of the Affordable Care Act that actually works. And that's what we have to do.